Hello, thank you for attending ABIPP practical examination briefing for candidates. This is meant to familiarize you with the examination process and to make you much more comfortable in taking this examination. Just imagine that you are dealing with a patient. This should not be of any stress. It probably is more stressful for the examiners than the candidates themselves. As I always say, the easiest examination I have taken was FIP, and the examine hardest process I have had is being an examiner for FIP. The FIP is very similar to ABIP examination, or ABIP is similar to FIP examination, the practical examination part. There are significant changes in the qualifications, etc. In any case, moving forward, this is meant for candidates to make you comfortable. At the same time, we will talk some information about examiner examiners also. Please do not share in any format about the examination with anyone. This is confidential agreement. In addition, please follow all COVID-19 precautions for your safety and our safety. We are also going to talk about ABIP Part 2 examination, and at the same time, we'll touch some on competency examination. As you know, competency and board certification are not equal. Board certification is much more complicated than competency examination. So, for a ABIP certified IPM physician, you have to meet certain criteria. These include pass or qualify for ABIP Part 1 examination, pass the ABIP Part 2. You must have adequate physical and sensory faculties. You must be free from the influence of or dependency on any type of chemical substances. There must not be any felony on the record. You must have unrestricted license to practice medicine. The attributes we look for in a diplomat are application of knowledge, judgment, adaptability, organization, and presentation. Some of the facts we would like you to know, and that is what ABIP expects from you, and the examiners will be testing you on these aspects. These are in-depth knowledge of all drugs and interventional techniques, pathophysiology, alternate methods of management, different techniques, including interventional techniques or conservative management, surgical management, any type of alternate method of management. Methods of assessment, how do you assess the outcomes? It could be osmosis disability, neck disability, VAS, NRS, other functional status, how long a patient can sit, walk, stand, or any other approved or validated outcomes measurements. At the same time, you should be able to anticipate, diagnose, and provide rational therapy for any complications that are likely to arise. Now, ABIP Part 1 is primarily a test of knowledge. It is used to determine if a candidate has a sufficient fund of knowledge in general medicine in the specialty of interventional pain management. It is designed to test the knowledge gained during training in a fellowship or 3 to 4 years of practice. To be qualified for ABIP board certification, you have to have a specialty certification and competency certification. This is given in the form of competency certifications in controlled substance management and practice management examination. This can be given as a separate examination or path. If you are at this stage taking part 2, that means you have completed this part, or as an alternate, you can just pass part 1 examination, which encompasses all the requirements. For competency examination, written examination is included in the same examination, in one examination. So for part 2, you have an oral examination Then competency evaluation. Do not confuse this competency certification. Competency evaluation is your technical competency and safety along with management of the complications. More than the type of technique you use, it is the safety and how you recognize the complications and manage them. Weight is 40% for oral and 60% for hands-on competency evaluation. In contrast, ABIP competency examination is only one examination. It is a written, oral, technical competency. This can be given in one setting, but at least the score is all in one setting, even if you take them separately. Weight is 40, 20, 40. For a written examination, it is 40%. For oral examination, 20%, and technical competency, 40%. For ABIP Part 2 examination, there are 18 tech IPM procedures we utilize. So you will get one of these procedures. For ABIP Part 2, you get 4 of the 18 procedures to perform. These include caudal epidural injection, lumbar interlaminar epidural injection, and also lumbar transforaminal epidural injection. After that, you also include cervical epidural injection and thoracic epidural injection. So you have 5 types of epidural injections included in this. After that, you include lumbar medial branch blocks and L5 dorsal ramus blocks, cervical medial branch blocks, thoracic medial branch blocks, radiofrequency neurotomy of lumbar spine, cervical spine, thoracic spine. So you have 6 facet joint interventions procedures. Then we have sacroiliac joint injections. Next procedure is cervical sympathetic or otherwise called stellate ganglion block. You also can be tested on lumbar paravertebral sympathetic blocks, lumbar discography, celiac plexus blocks or splanchnic nerve blocks, percutaneous epidural adhesive lysis, and spinal cord stimulation lead placement. Examination is based on general knowledge of IPM field. The examiners follow a script. The scripts are based solely on practical scenarios. Just imagine that you are treating a patient and just behave like how you are treating a patient. And also remember that you're not going to provide care to somebody, some type of care to anyone, if you don't provide that to your mother or someone close to you. That is very important. That is what I call your mama test, where you can only do a procedure on anyone if you can do it on your mother. Remembering that you have 2 brothers, they are bigger than you, and your mother loves them more than she loves you. So coming to the behavior, you must act professionally and treat examiners as colleagues. Speak up and make good eye contact. Don't start being enemies and nervous and anxious. Do not argue with the examiners. Give the examiners a handshake if it is allowed based on COVID-19 pandemic restrictions. But if it is allowed, go ahead and give a handshake at the beginning and at the end of the examination. Even if you feel that you did poorly, you're extremely nervous and you don't like the examiner, avoid slang and informality. Don't joke around. Don't play with your pen, jewelry, etc. You are graded on clinical skills, mainly the safety. Safety is of the prime importance here. Then management of clinical scenarios. Can you recognize a complication and can you respond quickly and appropriately? You are not scored on one question, you are scored on overall. That is how scoring is done. If you do a major error, that becomes a major issue here, and that may lead to failure of the candidate. It is like penetration of the spinal cord and inability to recognize it as a serious mistake. Keep trying to cover it up and not knowing where you are and not knowing what is the next step. So the score is related to the overall performance. That is the bottom line. It is a scaled score. It is multifaceted analysis. It is consistent with the failure rate of anywhere from 0% to 40%. However, just remember, one examiner can never fail you. It all depends on multiple examiners. Above all, we will have proctors looking at them. And whenever there is a question about anybody's examination, we also look at the results. So you should be able to answer why not something else. There is no right or wrong answer. And don't be very, very regimented. Don't try to follow a philosophy of one society, one person, one organization, or something you read. But rather than that, you should be flexible and should be able to understand multiple techniques. So that's why it is okay to say you're not comfortable with a certain technique, but you must know that it is possible. When you're asked the question, remember, like a deposition, just answer the question, but that is where it stops. Don't ask any questions to the examiners because they don't have any more information than what they have told you, but you have to provide a clarification. You have to answer the question and explain about it. Then for the examiners, you can also ask the clarification if you really don't know what they're asking. Just like you ask an attorney, can you repeat the question? When you are asked a question, don't rush into that. Listen to the entire question and then answer it. Once you answer it, again, immediately justify why that was your answer. So I'm doing X and this is why. They don't want to hear all the things you could do. Just pick one. Say, I would, not I could. So you need to understand the difference between would and could, just like should and must, shall and must. So there are lots of differences. Must means there is no other alternative. You have to do it. Shall means the same thing. But should means you may want to do it or may not want to do it. That is what Supreme Court ruled, the meaning of these words. It becomes much more important in fraud and abuse cases. They expect you to be able to defend your selected plan of management. Whatever the plan you have, get ready to defend it. They will interrupt when you have said enough. You keep going on and on and on, they are going to interrupt. Sometimes you talk a lot, but don't say anything, then they will interrupt you too. Explain your answer to the examiners as if they don't know interventional pain management or they just don't know any medicine at all. Just like you're explaining to a patient or giving a lecture to the public who do not understand it. So in this case, again, in contrast to the deposition, the explanation is more important than the answer itself. Imagine yourself with the patient again. Only do things that you would normally do. Just remember your mama test. Don't be afraid to consult another physician. This may be your colleague. This may be somebody else, another physician. Sometimes you can even consult your own partners. It doesn't matter. You can have anyone. You can also ask the radiologic technologist if they did the correct positioning and if what you think is appropriate, and you can take a different position and confirm it. But you should be willing to do that. This shows that you know when to ask for help as opposed to compromising the patient's safety. So again, patient safety is the most important aspect here. If you don't know the answer, be honest. Just you can say that I don't remember at this time. Don't ever make up answers. Don't quote a book or article unless you're prepared to have a detailed discussion about it. Don't develop your position statements by reading an article unless you really understand it and you are the one who wrote the article and you're following it. Just reading an abstract or reading a news article or somewhere else or somebody told you, that is inappropriate for you to even mention those things. You can say that you heard that, then it becomes anecdotal and it's not very important. You're just wasting the time. So you do need to understand exactly what you are talking about. Always, always, always keep the patient safe. So you realize you made a mistake, then go and admit it. Nobody wants you to be wishy-washy. And you don't have to stick to your guns, but you can stick to your guns that you made a mistake, and stick to your guns and explain what you meant if if the examiner misunderstood. But if it was a really a big mistake, just go ahead and admit it. If you realized it, then move on rather than going down with the sinking ship. If you realize that, again, we made a big or killing mistake, always say, I'm sorry, but I keep going on. Most of the times, what we have observed over the years, and this is what examiners have observed all of this across all disciplines, they have superficial knowledge, some of them, and then they project like they have very significant, deep understanding of the subject. Indecisiveness, faulty judgment. They, they don't take the test seriously and they're not prepared to take the examination. They just get up and come. They just keep saying that, oh, I didn't have time to do it. I have not looked at this in a long time. That's not the way you are going to impress the people. And you can talk a lot, but say nothing. That is not going to help you at all. Try to control the examination. Do not try to control the examination. That's a major, major problem. Some of the examinees, you go into different subjects, keep talking about it. Last time, one time we had a candidate, he was explaining and explaining, arguing about Baghdad's position, how he was wrong, and so on and so forth. He spent 45 minutes or so on it. Finally, I went to him. They called me. I went to him and tried to explain. There was only 30 minutes left over, but he still was doing that. I finally told him that you can stop right now if you want to, but you have only 30 minutes. If you want to finish, you can go ahead and finish all the cases. There is no way he could have finished 30 in 30 minutes, those cases. He was not able to, of course. So that results in unnecessary stress. In reference to the examiners, they get the case at the same time you do. They don't have any advanced knowledge at all. They're also told not to focus on their personal opinions and specific techniques, just like you are told. It is the knowledge, it is the safety, and how you can reach the goal any way you want to, rather than, which is approved way, of course, rather than whatever you think is the right way to do it. So generally, the examiners are in a single room, either oral or competency exam. They finish their grading within 1 to 2 minutes of the completion of the exam. They do not discuss the examinee with each other. So there is no collaboration or coalition or anything like that. So total, you will face 4 examiners, 2 per oral, 2 per competency. We also audit the examiners. So whenever there is somebody in your room that is not for you, they're not watching you, they're watching the examiners. They are audited a few times during the exam. It may not be during your time or later or any time, but there will be some. There will be strict quality control. And if ABIPP has a problem with an examiner and we receive multiple complaints on the examiner may not be asked back. Each examiner is graded for performance and fairness. Examiner is audited for following things like questioning. if examiner is providing inappropriate positive or negative feedback or reinforcement, or asking rhetorical questions, showing aggressive or threatening behavior, if the examiner is covering all of the script or not. We also evaluate them if they are, how their emotional status is. They should be unemotional and they should not give any feedback. They should not be trying to guess the co-examiner's rating and matching those ratings or what co-examiner is going to ask. They should take into consideration all the answers together, whether examiner, the answers are related to you or the other examiner. In reference to the dress code, preferable is white coat or scrubs. White coat probably is better, especially oral examination. Scrubs is good for competency examination because you will be wearing a X-ray jacket over it. And you can wear a jacket too if that is what you prefer. Shoes. Jogging attire is inappropriate. Shorts are not admitted, not allowed. Always bring your X-ray glasses if you want to. There will not be any X-ray glasses there. And X-ray jacket and neck collars or thyroid collars are available. So if you want to save time, especially for the cadaver workshop or anywhere you're going, you can change in the room. That will save the time. But for workshops, technical competency, if it is performed at the lab, we may perform both at the lab sometimes. If it is performed at the lab, there will be a changing place there. The lounge will be there. So what do you bring to the examination? Basically nothing, just your ID. You can't bring anything other than your ID into the room. How do we do the oral examination? In each room, you are given a water, a pen, and a piece of paper. ABIPP will check your ID. The examiners will introduce themselves to you. They will verify the case with you. At this time, you may switch if you feel that you know an examiner. There may be an observer in the room. The observer does not grade you. Observer is grading the examiner, as I told before. And for part 2, oral examination is for 1.5 hours and competency is 2.5 hours. It is again technical competency, safety, and management of complications. There are 2 cases given to you, 45 minutes each. First case, 5 to 10 minutes. You look at the case and you may take the notes, and discussion is 35 to 40 minutes. Second case, 5 to 10 minutes to look at the information. Candidate may take the notes, 35 to 40 minutes. And you will also be given images and asked to interpret them. Competency examination oral format is somewhat different. As I said, board certification and competency certification are not same. There will be 2 cases, 30 minutes each, total 60 minutes. First case, 5 to 10 minutes, discussion 20 to 25 minutes. These are essentially the same things, but less intense. This also includes imaging. These are the instructions you receive as soon as you enter into the room with an envelope. Instructions about that. There are 2 summary cases and 2 cases will be enclosed there, and you will be allowed to look at 5 to 10 minutes, and then you can take the notes, and you are encouraged to take the notes. The oral format for competency is the same, but slightly less time. Case presentation. First, you talk about the history, physical examination, investigations, imaging, EMG, nerve conduction studies. Now there will be multiple questions with COVID interface. So in the oral examination, they will ask you, what is the differential diagnosis? What is the most likely diagnosis? What additional tests or labs are indicated? What consultations are indicated? Do you see any medical or pre-op preparation concerns? Here, again, COVID-19 interface will come into act. So what pre-op testing you perform on them, how does that increase the risks? If you're doing procedures on them, what precautions you take, and what precautions you are using in reference to the infection control in your facility, and interventional diagnostics when any other radiological or diagnostic testing is indicated. Treatment module, what other IPM procedures are applicable in this case? What other treatment modalities may be indicated other than interventional techniques? What drugs are included and what consultations are indicated? Again, if there is any interaction with the drugs, with the COVID-19, let us say somebody is in the active vaccine phase. They took their vaccine 2 weeks ago and they wanted to have a epidural injection. So what is the relevance there? Is there any importance? And somebody had COVID-19 after 2 weeks or 4 weeks or 6 weeks, want to have a spinal cord stimulator placed. So how do you handle that situation? Complications. Complications related to everything, life-threatening, major, and minor. These are the 3 levels of complications. Image interpretation, they will grade you based on a number of images you look at. Technical competency examination process. At each station, we'll provide you with a C-arm and other necessary equipment. And once you come in, ABIPP will check your ID. The examiners will introduce themselves to candidates, verify the case. They will give you another envelope here again. At this time, candidates can switch if the candidate feels that they know an examiner. There may be an observer in the room. Again, they are grading the examiners. The total time you get is 2.5 hours, 150 minutes, 4 total cases, 10 minutes to look at cases, 25 to 35 minutes per case. Demonstration. Examiners will ask questions and interact with candidates. Each examinee is evaluated for competency in 4 of the 18 designated techniques. And this is the envelope you get, and this is the way your cases will be listed, P1, P2, P3, P4. And instructions will show you 150 minutes is given. You take several minutes, but no more than 10 minutes to review the 4 procedures and prepare yourself to begin. Approximately 35 minutes are spent on each case. If you can finish all 4 procedures 10 minutes early, that would be good. If not, it is okay. You can take full 150 minutes. Describe to the examiners what you are doing as you do it. During the procedure, examiners may interact with you and ask you questions. Competency examination is slightly different here. It is 90 minutes, only 3 cases. Again, 5 to 10 minutes to look at cases, 25 minutes per case. They also get 3 out of 18 same cases, and they also get envelope and cases. Again, they will have, the timing is limited for them and they have to finish that in 90 minutes. These are the 18 cases. The scoring sheet for practical examination, they start with everything, patient positioning. And most of the times everybody gets good or excellent in patient positioning. This is followed by C-arm positioning. If you understand the C-arm and how you are going to do it, this should be easy to pass. The needle placement and drug administration and complications, these are the 2 issues where you can have issues, and these are the major issues. And finally, do we have a fatal error? If you have a fatal error, that is the one which becomes a major issue. We have already said what a fatal error is, like entering the spinal cord, entering the chest, puncturing the lung, and not recognizing it. Summary score is that no deficiencies or indicate 1 or more deficient attributes, if any. Then deficient judgment, deficient technical skill, deficient interpretation. So this is not for you. This is for examiners. That is how they use the practical scoring sheet. So I hope this was helpful to you. But finally, we want you to be calm and cool, concise and cordial. Just remember, sky is not falling. That's why you have to be collective and comprehensive. So pass the examination. But even if you don't pass it, it's not the end of the world. Sky is not falling again. Good luck next time. But hopefully you don't need any good luck next time, and you will pass and you will be board certified. Thank you.